everybody. This is the Certified Sarah Ballers, and welcome to our podcast on balancing burnout.
Welcome back, guys. Thank you for joining us again. I'm Lauren.
I'm Caitlin.
And I'm Michael. And today we have a very special guest with us today. I'll let him introduce himself.
My name's Amir Louka. I'm an emergency physician here at VCU, and I specialize in emergency medical services.
Thanks so much for being here with us today, Dr. Louka.
It's a pleasure.
All right. Well, getting right into, the big meat and potatoes of our podcast. Dr. Louka, if you don't mind, how do you define burnout?
Wow. I mean, I think that term is a really difficult term because it means different things to different people, and it might mean different things even to the same person. I think there's different ways of thinking about what I think most people conceptualize as burnout, which is, I guess, being tired of your job, I think that term almost makes it seem pathologic, like you should love your job, but you don't, therefore you have burnt out. Everyone else loves their job, but you have burnt out. And that really isn't very accurate, because what ends up happening, at least I can only speak from my line of work, there are various pressures that are negative and things that are extremely positive about any, especially a career in medicine. Today, for example, I came in and the first thing that I had to do was complete 2 required modules on compliance that had to do with like information security and whatever else. That made me not like my job.
Yeah.
And
you didn't love that? It wasn't super exciting?
These are things that you just have to do, and the more of them that get piled on, all you want to do is go take care of sick patients. And but there are these aspects of any job that enough of them and enough of them get piled on, and sure, you're going to feel kind of sick of it. Is that burnout? I don't know. You may have, a day in the emergency department, which for me might look like, multiple cardiac arrests, gunshot wounds, whatever, mass casualty, something. That to me is a great day. I'm thoroughly enjoying that day because that's what I want to do with my life. Whereas for other people, that might be, a day full of individual, very stressful events, which cumulatively, individually or cumulatively, may result in, some degree of post-traumatic stress. And people think of that as a single event, sort of breaking you. But it's not always. Sometimes it's just a career, years or months of back-to-back sort of micro traumas that eventually just pile up and overwhelm you. So is that burnout? I don't know. That doesn't sound pathologic. It sounds like that would be a hard thing for anybody to manage. So any term that kind of makes that seem abnormal, I think the normal response is to be fed up with, with that kind of thing. So the term burnout itself is not very specific, and there are certainly things that there are things about my day-to-day job that I love, and there's things about my day-to-day job that I could do without. So I think you'll find that's the same for most physicians, and probably garbage collectors and accountants and anybody else. So.
Well, I think that was a really insightful answer, and some things you brought up are things that I hadn't really ever thought about. So I'm curious, being in an academic institution, do you discuss burnout as a subject, like in the workplace with other people here within the academic center and then in the ED?
I think, as when we work with residents, we talk about these things, all the time. And especially, as the residents progress, early on, it's a bit of a culture shock coming into a place, especially a place like this. So we try, especially as an attending, try to, when you see somebody's maybe struggling, pull them aside, chat. We actually started a program in the Department of Emergency Medicine called Project Carlos, and that was based off of a resident from the University of Kentucky who committed suicide when I was a resident. And so we brought this program, which is a peer support sort of wellness program, to our residency. And named it after him in an effort to provide some degree of peer support. I personally benefit from, my wife has the exact same job as me. We literally work shoulder to shoulder some days. So I don't know if that's a blessing or a curse, because when we go home, we're still talking about the thing. So but at least I've got somebody who 100% gets it. She's not just saying, I understand. I know that she actually understands, because she's done the exact same thing that I have and was possibly even physically there when it was happening.
Mm-hmm. Mm-hmm. And do you have these conversations not just with residents as part of like a learning experience, but with your colleagues at all?
I had a difficult case recently through I do all this EMS stuff. Half of my job is being an EMS medical director, and so I spend about once a week, I go out and spend time out in the fields, and we had a difficult case, pediatric cardiac arrest, that I was there for, and that's not something that I regularly do. I'm an adult emergency, for the most part, I'm an adult emergency, physician. I go to New Kent every now and then. We take care of some kids, mostly stuffy noses and stuff. But here, we've got a separate peds ED. I don't see kids, coding all the time, especially, small ones. And I was struggling with that case. I was struggling with processing that case, and so I did pull aside one of my colleagues, and we chatted about it, and that was very helpful. I think that's important. I think, again, though, I'm not sure that is burnout. I was definitely feeling pretty unsure about about myself, about my job and all of this, but I think that's kind of normal after spending an hour doing CPR on a baby. That's what a person should feel like, and maybe that even means that I'm still really engaged in my career, and still compassionate, and still, so maybe it's a positive in some weird sort of backward way.
I wonder if conversations like those are maybe a way to prevent burnout, or a way to make it so that what we talked about later on in burnout doesn't happen or hit as hard.
I think it's if you want to have a long and fulfilling career in anything, medicine, it's just a little bit more difficult. But in anything that you do, I think balance is really key, right? And being able to set some degree of personal boundaries, right? So I think COVID kind of woke a lot of people up to this idea that work is not my life. Work is something I do as a part of my life. And I am going to take a day off this week. I'm going to turn my phone off, and I'm going to say no to something, and maybe not go to that meeting, or, teach that extra class or whatever, because I really want a day off to spend with my family. And I think COVID kind of made it okay, societally okay, for a lot of people to do that. Whereas for most of my career and through med school, the impression was, you are a physician. Not you're a person who happens to be a physician, but you are a physician, and that is who you are and what you do. And that kind of makes it sound like a 24/7, 365 thing, which it doesn't have to be. Mm-hmm. And I think if you make it that, it's going to be a lot harder to, when these things start to pile up, when the micro traumas that we all go through, or just the micro stressors that we all deal with, when those finally pile up, it's going to be harder to deal with if your entire day, week, month, year is work. having something else, and for me, that something else happens to be EMS, which funnily enough is my work. But I find it extremely, I find that relaxing and enjoyable, and I can really get engaged with that. I do that for free, and then I'm able to carve out time specifically to spend with my family, and travel and things like that. So that's critical, I think.
Yeah, I think I've definitely started hearing more and more from, people my generation and other generations since COVID kind of happened. It's the motto of work to live instead of live to work. We do our job so that we can then go out and have experiences and enjoy our lives and do things like that instead of we're living our lives so that we can go to work every day. And I think that's very, it's kind of echoing a little bit of what you said. And I think that it's important to think of it that way. I guess kind of going back a little bit to kind of talking about kind of like your definition of burnout a little bit. Some of the stuff that I was reading was kind of describing different components, I guess, of what could almost describe burnout, which it sounds like you mentioned some of them and don't mention others. And so maybe that's, it's almost more fluid than some of the definitions we give. But, one of them I saw had these 3 components to burnout, which is like depersonalization. So like the idea that you separate yourself emotionally from your work, you're just doing it, you're not investing yourself, you don't have a sense of meaning in it anymore because it's just too much. And then there's also like the decreased sense of accomplishment, that you don't have that when you're working anymore. You don't feel fulfilled. And then the last one is kind of emotional exhaustion. You just are emotionally exhausted from doing the job to the point where you can't even feel the energy to do things afterwards because of that. And, they kind of talked a little bit more of like emotional exhaustion is mainly particularly like felt by women, and the depersonalization and like not feeling fulfilled is particularly felt by men, and things like that. But I think it's interesting to think of it in those lights, which is a little different than the field that you're in, which, you have these kind of, like you said, the micro stressors and the almost kind of traumatic things that you see almost every day in a day-to-day, which almost has a different kind of stressing effect on your life than these personalizations, because it doesn't seem like you're not feeling fulfilled by your job. It's more of like it just gets really hard to do that day in, day out.
Yeah, and it's funny, the things that to me are stressful are not the same, and I assume to all physicians, it's not the same. If I had to set up and run a dialysis machine, which I have no idea how to do, I would be really stressed, much like a nephrologist trying to run a code would probably be very, stressful. For me, the major, the things that I find difficult are more the day-to-day, the person who's yelling at you for pain medication, the heavy influx of primary care or psychiatric care patients, neither of which I'm really trained or equipped to manage, but that's overflowing my ED while somebody in the waiting room has chest pain, which is 100% something that I'm there to take care of, right? So those are things that are very stressful on us, which in and of themselves may not seem particularly difficult, so I think, those are... my colleague, the one that I was talking to about this baby, he used the term occupational anhedonia, which I thought was just such a perfect way of summing up, and I think some of us, all of us probably, go through these sort of normal ebbs and flows of loving your job and feeling a little bit, in the ho-hum about it, and then loving it again, and you have these sort of episodes. Where it becomes an issue, where it becomes pathologic, is when that has, one, started to bleed out into the rest of your life, right? If I'm now not able to enjoy time with my family because of what's, the work has sort of bled into that, then there's a problem, and something, we need to address that before it becomes more significant. Or, the people who really want to be engaged and want to love their jobs, but something specifically about it is creating a barrier to being fully engaged and advancing and progressing in the work that they do. That can be an issue as well.
Yeah, I think that's a really interesting point, because one of the studies that we found was showing that physicians with lower tolerance of uncertainty had higher likelihood of feeling burnt out. And I feel like that's kind of one theme that I'm getting from what you're saying is like, if physicians might not know how to treat a certain thing, and that's something that they're faced with more frequently, then that could lead to higher burnout. How do you feel about that?
It could be. I mean, I think a big part of it is we are all asked to, there are obvious societal issues with American healthcare, right? That are pervasive and way bigger than any individual person, and all of us are carrying some degree of a burden of trying to wade through the muck that is the American healthcare system. Whether that is you're trying to run a business and deal with insurance companies, if you're an outpatient doc or a surgeon running an outpatient, surgery practice, they're also like graduating and all of a sudden you're the CEO of a business, which I don't think they teach you how to do that in med school. At least they didn't teach me, right? Thank God I don't have to deal with that, right? Or, you may work at an academic, safety net hospital like this, where you're seeing kind of the other side of it, which is I don't have to worry about the business side at all. Instead, I'm dealing with the people who have no access to care, or maybe I am their only access to care. More so than just, I'm not quite sure how to splint this thing. I can call a consultant for that. It's more, I don't know how to get you the help that you need, or maybe I do, but it's not an option for you. Those are, I think, as people who want to make a difference, want to make people feel better, that's a really hard thing to do. And then you got to have a conversation with somebody that's very difficult, but on the upside, I think that we all have, really positive aspects of our job, and I don't want it to be in any way, I don't want to be a downer about the world of emergency medicine. I think it's excellent, and I love, many aspects of my job. Just yesterday, I had one of the best days I've had in a long time. So you get some really rewarding. You clearly know that you made a difference, and that's awesome. There aren't many things where you can really put your finger on and say I made a difference right there.
Mm-hmm. Yeah. One other thing that we like to share and like kind of get your opinion on in this podcast is we've done a lot of research, I guess, looking into burnout and kind of the prevalence and pervasiveness of it. And so kind of just sharing some of the stats that we found and seeing kind of what your thoughts are on it, if you agree with those, if you think they should be higher, if you think they should be lower. Okay. So an article published in 2020 that found evidence of burnout in 42% of 15,000 U.S. physicians that responded to a 2018 online survey. They did a repeat survey in 2019 and again found the rate to be around 44%. And as well, with that one, they saw that 14% of the responding physicians had suicidal thoughts as well. And of those 14%, only 33% of them actually sought treatment for these suicidal thoughts. What are your kind of thoughts on these numbers?
I mean, I think I wonder how that question was phrased to them, right? Because if it was, do you at times find your job overwhelming? Or stressful, or do you consider leaving because of not liking your job? That number's probably 100%. I couldn't imagine a single doc out there that hasn't at some point thought, what on earth am I doing with my life doing this a day in, day out, right? But then they'll come to work the next day and, something wonderful will happen and they realize, okay, that aside, there are great parts of this. So I wonder how that question was phrased, because if it's, do you have, crippling PTSD that's affecting your family life, it's probably a bit lower than that, I would imagine, right? So it's there's somewhere in the middle, and I'd wonder what they mean. In terms of the suicidality aspect of it, I'm surprised that it's you said it was about 30% are in treatment.
Yeah, only 33% sought treatment.
Oh, I'm surprised it's that high. There's no worse patient group than physicians. I mean, I'm awful. I don't know how my wife puts up with me. It's a single sniffle and I'm either dying or I could, or something horrendous, and I refuse to go to the ER. So, I'm surprised that it's really that high. I would imagine that the overwhelming majority of docs would try to self-treat or ignore it or drink or whatever, or buy a Ferrari.
Why do you think that is? I'm really curious to hear your answer. Like, why do you think that is?
Have you ever been a patient in the ER? I wouldn't.
No.
Yeah, I don't know. I mean, I think on the one hand, well, I'll tell you this: every single time a doc does credentialing at a new hospital, right? And then there's all these things about non-discrimination and whatnot. Every single time a doc credentials at a new facility, you have to answer a checklist of questions, one of which says, are you currently or have you been treated for psychiatric illness or, what?
Really?
Still ask that.
These are always there, right? So, okay, I'm applying for a new job. You're going to be my boss, and in order to get this job, I have to answer a question that says that I've, sought psychiatric care or whatever. So these things, and that there is still a stigma there associated with it. Partially because they're continuing to ask the question, right?
Yeah.
So it's like the question right after, do you have any felonies? So the fact that it's on the same checklist is kind of just telling of where people think about this. So I think there's a cultural component. I think there's the internal component of I'm fine, I can take care of myself. I'm a doctor. I know how to help people. I know what's wrong with me, therefore I can fix it. We often recognize the symptoms in ourselves and so think, okay, if I've diagnosed myself, why would I need to go talk to a psychiatrist to tell me what's wrong with me? So I think that's probably one aspect. But yeah, I really think that it's probably multifactorial why that is.
I have another quick follow-up. So then I'm curious what you guys go over with the residents. Like, how do you define, I guess, burnout? And then how do you advise them to go about it?
So my common spiel with the residents is, someone will come in and it'll be might be like a old lady with dizziness who's got some component of dementia, whose family dropped them off and now isn't answering the phone, who, like some very vague set of symptoms and difficult to navigate social circumstances, right? And they'll kind of it'll take up their entire shift. And they'll spend the whole day kind of trying to figure, like I said, wade through the muck of this situation. And it'll take up their whole time. And I'll say, this is the hardest patient that you will take care of. And it's okay to recognize that. You think you can't think about it the opposite way, especially when you're an intern coming in. They have the trauma bay that's set aside. I don't know if you guys have been in there, but they got the trauma bay that's set aside, and they got the lights that go off when there's a trauma or a critical medical patient arriving. And, the senior resident will go over there with the attending and take care of that patient. And so you sort of think about it as like, oh, those must be the really hard patients because that's like the senior and the attending are going to go manage that. But the reality is the guy from an emergency medicine standpoint, the guy that comes in shot in the chest is really easy for us, right? They're probably going to disappear to the OR in about 30 seconds. Okay. I know how to do ABCs. It's what I've spent my whole life training to do. And I've got a whole team of nurses, doctors, and specialists who are there to support me in managing that patient, right? The little old lady who's got vague symptoms and no social network, I have limited support. I don't even know who to ask for what if I did have something that I needed. Minimal access to, whether it's they need placement or they need physical therapy or they need whatever. You're all on your own. You feel alone with that case. And I think it's important with the residents, at least for me, the conversation that I have with them is identifying that it's okay to be stressed about this patient, right? And it kind of goes back to what I was saying earlier about is burnout something negative, right? Is it a pathological response? And in that case, you have a normal response to being annoyed and stressed out and frustrated with this patient, right? Because with the care, the situation, the care of this patient, because it's hard and it's the hardest patient you'll take care of. Gunshot wound to the chest, I can tell you what's going to happen as soon as they come in, what's going to happen in the next 10 minutes. I can probably tell you what their care is going to look like 3 days from now when they're in the ICU and getting Dopplers to look for, routine DVTs. And that, like, there is a very clear path for those sort of patients. So recognizing it, calling it what it is, and then being able to self-regulate your response to it is critical. Otherwise, you're looking at it like, why am I so frustrated? This should be easy. There's nothing wrong with this lady. This should be super easy. Why is it so frustrating? Why does it make me so angry? And then inevitably that either gets taken out on your life or on the patient, and that's not that's not a healthy way to live. So
yeah, it's kind of almost going back to kind of what was said earlier. It's you are basically trying to prevent these kind of feelings by building up that tolerance of uncertainty with these interns, being like from the beginning, it's like, you're going to be uncertain, you're going to be frustrated, it's going to seem like it should be a simple case and it's not for some reason XYZ, you don't have the support, you don't know what imaging, you don't even know how to order the imaging, and kind of building up that resilience to being okay with being put in those situations and keeping your cool and keeping your calm, that almost helps them then as future physicians when they are that senior doing the trauma that, it's a little more routine, but they can keep their composure that whole time and kind of prevent
Absolutely.
feeling overwhelmed, prevent feeling that depersonalization, derealization of the moment, because they're like, I'm built up, I'm resilient, it'll be okay. Yeah,
absolutely. And I can only speak for myself. I'm sure there are other folks out there that have a very different approach to this. I think the other thing is once they realize that this is difficult, then they can start to realize that they're not supposed to be able to do it all on their own. And it's okay to ask for help. It's okay to load the boat. I ask for help from colleagues and consultants 50 times a day, multiple times on each patient sometimes. I'm asking whether it's the nurse or the pharmacist or, surgeon or whoever, I'm asking for help and making them understand that this is a team sport. The burdens and the weight of what they're trying to do is not something that's designed to be carried alone. It's something that is supposed to be managed by a team. And it's just a matter of kind of being able to take a deep breath and figure out who you're going to ask.
So we've talked a lot about and kind of touched on things that, you do to escape work, and that work is also something that, helps you prevent burnout or accumulating microstressors in your life. What else do you do, I guess, more specifically to kind of, prevent burnout in your life? And what would you give as advice for like an upcoming intern to kind of prevent those microstressors from accumulating?
Well, one, I don't know that I'm any more successful at it than anybody else. So, I can only say that what I try to do is recognize that there are these stressors, right? Recognize that my response to them is probably normal, right? Or when it's abnormal, acknowledge that it's, abnormal. Seek support, whether it's from my wife, my family, my colleagues, and set boundaries. I think, this is something that has to be okay. And you've got to realize that this is a real thing that's out there. And it's a real part of the job. If you can focus on the things that are positive, I think you have to accept that no matter what job you do, there will be positives and negatives, right? And I think that we as a society kind of paint this picture of like a life of medicine of one, you're supposed to be this ultimate compassionate, caring, altruistic person. All right, you should be a gold humanitarian, exemplar person, right? And the reality is sometimes you're just kind of annoyed by somebody, and I think it's okay to acknowledge that not every patient interaction is going to be you floating down on angelic wings, laying hands on somebody and saving their life, and making everything better. That's not realistic. Recognizing that, you can kind of be like, okay, there will be some parts of my job, like we sometimes get stuff like, neurology. I'll pick on neurology. I hope they don't mind.
None of us are going into that, so you're good.
And let's say the person comes in with a headache, all right? And for some reason, I don't know, for whatever reason, we end up talking to neurology. And maybe they're frustrated that, what do you mean it's just a headache? This isn't status epilepticus, brain tumor, whatever. It's like, man, if you didn't like headaches, neurology was probably not a great decision,
Yeah.
And there are just these parts of it. Or maybe it's okay. Maybe you love status epilepticus and it's great to be a neurologist, but you kind of have to accept that you're probably going to see a lot of headaches as well. And that's okay. As long as you're getting a lot out of whatever it is that you do, but you realize you're probably never going to avoid headaches, that's okay. For me, I am never going to avoid med refills. They will continue to happen, and those patients will continue to come in, and I just have to recognize that it's quick, it's easy, I can just get them out the door and go on to doing whatever it is that I do while focusing on the really positive aspects of my job, and the things that I think really do make a difference. So those are that to me is the most important way. One of the docs, actually Dr. Moffat, who's now the program director. I remember when I was a second year resident here, I was very much going through the second year kind of hump of like, what am I going to do with my life? Am I going to do community medicine, which is, working for corporate medical groups and stuff, and it's just awful. Am I going to work in academic medicine and take a huge pay cut and work a lot more, and, it's going to affect my family life? Or, you kind of focus on this, like, the worst aspects of both sides of the coin, and so you go through this hump. And I was asking him about this, and he said, one of the things that got him through that was every day, every time he goes to work, focusing on at least three things that went well, three things he's thankful for at the end of that shift. And one thing that really stuck with me, he said, some days that might just be that a patient sincerely said thank you. That could be sufficient. And I pick out those all the time now. Some people are like, thanks, but some people are truly like, thank you so much for what you did today. That to me is like, all right, this is all worth it. I clearly made a difference for that person. I made their day better. So if you can focus on those kind of things, or sometimes it's a big thing. Sometimes you make a big win and, it's kind of a slam dunk case. Those are great too.
So to me, I mean, it definitely sounds like it requires, in maybe a summary of what you said, of a sense of self and a sense of identification of who you are as a person and what is going to stress you out, but also perspective. Like, our jobs are hard, being a doctor is hard, but if you can emulate or view this positive perspective, then that might just make your job a little bit easier and a little less stressful, which is very nice to hear, especially going into residency soon.
Yeah.
So
Yeah. I mean, if it was easy, everyone would do it,
right.
And that's not to say that I don't know. I mean, being a teacher seems incredibly difficult, way harder than my job, But I can only sort of speak for my own life, and the things that I do and the things that I find that I take a lot of value in. So I'm grateful that my job gives me time to spend with my family, time to, hang out with my kids. And with all of that, once I sort of do the equation, the pluses, the minuses, it continues to add up to a big positive for me. And the day it doesn't, I know it's okay. I can do something else, Although that kind of gets back, what you were saying about suicide earlier just reminded me of something I was going to say. I think there is a great fear in the world of medicine of many docs, especially early in your career, that you're stuck, that you're locked in, right? Because you said you're getting ready to go into residency, and you guys are all sort of waiting on match day, right? That's your specialty. hope you made a good choice. You know what I mean? You know what I mean? And the reality is, if you're a PA or a nurse practitioner or something, you could be a neurologist one day and the next day go get a job with cardiology and do something different. You know, if you work in IT, you could be a skydiver the next, you know, like you could do something else. When you're a doctor, you are an emergency medicine physician and you've got $250,000 of loans to pay. And if you could go be a, you know, whatever, an artist, but you're going to struggle to pay off the $250,000 for that first, you know, decade. So I think a lot of docs feel trapped. And that's an issue with the system, really. It makes it very difficult. And as an M4, as a student, like I always wonder, how do people go into urology? Any of you guys going into urology? I never did a urology rotation. I never had an opportunity to do urology rotation. Maybe I would have loved it. And I don't understand the people who choose it, because when did they get to try it? Right? Like they had an early match, and they came out of third year somehow knowing that this is what they wanted to do, having never done it as a rotation. But somehow they chose to do this, not just for the next year or two, but for the rest of their careers, right? So there are some sort of systemic issues in the world of medicine about our inability to be sort of freely mobile, even with like state licenses. If I wanted to pack up and move to Oregon, okay, I got to get credentialed there. I got to find a job. You know, I got to pick up, move my kids. We're not very mobile people, and it's not a very mobile profession. You kind of grow roots, and you know, that kind of contributes to making you feel stuck. And I think ultimately, when somebody is contemplating suicide, it's because they don't think they have another way out. Mm-hmm. You know, so I don't know how to fix that. You know, the residency takes years to do, and it's a lot of time to invest. But I think it's important that you think long and hard about, like, not just is this fun, but is there a career in this for me? For me, that has meant diversifying, right? So doing some days of emergency medicine, some days in the office teaching the fellows, some days working with residents, some days teaching at conferences, and a lot of my time out in the field, which I know is what I love. So, you know, I know that I can, while I will always be an emergency physician, I can, you know, adjust the knobs a little bit of where I'm applying my time, you know, based on what I feel like I need. So I think that's an important part, to think that you don't have to clock in, clock out for the next 40 years and only do that. You got to find other ways to branch out.
It's making me so hopeful. I like it.
Yeah. Well, thank you so much, Dr. Louka, for joining us today. It was really enlightening. I really thought you brought up some really cool perspectives that I don't think we'd heard before and really thought of before. So we really appreciate your time. Thank you guys so much for coming. And to our listeners, thanks so much for tuning in again. This is the Certified Cereballers.